A very good evening, everyone, and thank you for joining us for this update. We will be addressed this evening by Prime Minister, the Honorable Amor Mottley, the Minister of Health and Wellness, Lieutenant Colonel, the Honorable Jeffrey Bostic, Senior Consultant Cardiothoracic Surgeon, Mr. Anthony Harris, and Consultant Manager of the Home Quarantine Program, Dr. Adana Grandison, is also with us. Minister Bostic will begin.
Thank you, Lisa. Good evening, everyone. I am here this evening to provide you with an update in relation to the COVID situation, particularly the challenges that we are experiencing. And before the evening is over, we will also give some indication as to exactly how we are dealing with those situations. Some of the things that we are putting in place, some we have already initiated. I can start by telling you, of course, and I know these figures are out, that today we had another 218 positive cases. And to say that the numbers at the moment are high, definitely so, but these are numbers that we have been anticipating given what has happened over the last 2 weeks or so, and especially within the last week. So, as I always say to you, our position is whether or not we are able to deal with what is confronting us in terms of the capacity. I can tell you that our isolation facilities are very, very, very challenged at this point in time, because we have been having more positives than we have been able to discharge persons from isolation, and that's given the large numbers that we are seeing. There are some days, for example, that we are okay because a lot of people would have been discharged, but then there are others where we are significantly challenged because the reverse occurs. So this one has really been a serious challenge for us, to be honest with you, but one that we are dealing with. And another challenge that we are having, and the two are related, and I would have indicated this before, is the fact that we've been having some challenges with the human resource component of our response, because we have a healthcare system, an entire healthcare system to deal with, and at times we have to strike a balance between COVID healthcare requirements and the general healthcare requirements of the population, and we don't want to neglect one in favor of the other, but sometimes striking that balance is a challenge. So that what we've decided is, obviously, if our isolation facilities are challenged and space becomes a problem, then we have to look at alternative means to be able to respond. And that is what we've been doing. And we've alerted you before that we were considering, and seriously so, the implementation of home quarantine and home isolation. And I can say to you that that is in progress as we speak. There are a number of persons who would have tested positive, and we are processing those persons to see who would qualify for home isolation and those that would have to be institutionalized. And so the triage process has commenced. We've been able to assess about 591 persons out of a total of 680. And out of those 591 persons, 22 persons were referred to Harrison Point, with another 12 in the process of being sent to Harrison Point. And that is because we are trying desperately to ensure that we get those persons who require urgent or immediate medical attention out of their homes and into facilities so that they can be taken care of. And we are doing everything possible to save lives in this process. So we have a team of medical personnel, doctors and so on, who have been contacting these persons on a daily basis, and we will continue with that form of assessment, also using telemedicine to be able to deal with any situations that might come up. And we are also in the process from tomorrow of rolling out an initiative in which we will be giving to those persons the thermometer as well as a pulse oximeter, so that we will be able to keep track on how they are progressing and their condition at home. And this is what we have to do over the next few weeks in order to really arrest this new development, because this is the first time that we've had such a challenge at our isolation facilities. But this is the nature of the game. This is what we're facing. This is what is being faced across the region, across the globe. And even though it is a significant challenge, and I'm not going to understate that because it is, but it's a challenge that we have to face up to. It's a challenge that we have to overcome, and we are employing everything possible to be able to do so. We will speak later, I'm sure, about the human element, the human resources element of this. There are a number of initiatives that have started, including the Prime Minister would have alerted during her press conference from New York that she had made some arrangements for a team from Northwell to come to Barbados to be able to see what we're doing and also to give assistance as required, and that team is fully at our disposal. They've been doing assessments at a number of our facilities, including Accident and Emergency Department. Unfortunately, there are a couple of intensivists as part of that team, and they also have been trying to provide some assistance, and we hope that this will be an ongoing process. But there are not, some other developments that we are looking at in terms of private sector involvement in this process and trying to really rally all those persons on island who have skills and specialist skills that are required at this time to be able to come together with us so that we have an effort that is harmonized, an effort that is going to be to the benefit of our people. So those are a couple of the challenges, the significant ones that we are having right now, and I am confident that as long as we come together, there are too many brains, too many highly qualified persons in Barbados that would allow us not to be able to do what has to be done. And we will do it together. I'm counting on all persons to continue to help us. Those who are at home, if you know you're supposed to be at home and indoors, please remain at home. This is a situation that we cannot police everything. And the reason why you may have in a country 1,500 policemen and 290,000 persons is because you always hope that the majority of people will do the right things. And we're counting on you to do the right things in this response. So those are the remarks that I would like to make at this time. And it's back over to you, Lisa.
And thank you very much, Minister. Mr. Harris will now speak.
Good evening, everyone. Thank you, Minister, for that introduction. I am here as just an old doctor in Barbados. I've been around now for 30-odd years, and we know that I have never seen any challenge like this in my lifetime. I am actually very happy to know that we are going to take on the challenge of home isolation and home quarantine. And I would just like to reassure the public that if the public, follow the instructions of the medical team, it would be a safe and easy undertaking. The equipping of the medical team with with thermometers and pulse oximetry allows you to check your temperature and the levels of oxygen in your blood. And with this, we can certainly pick up, even before you start to feel unwell, we can pick up signs that things may be going wrong, you may need some intervention, and hopefully then you will be able to quickly get back to the system. You can make your calls to ensure that you can have someone attend to you, or you can be directed where to go to get that attention. So I'm really here trying to urge you to follow the instructions as carefully as you can. The Ministry of Health doctors will give you clear and precise instruction that you can be able to manage yourself safely at home. And we expect that with this, we will be able to keep everyone safe and make sure that no one falls through the cracks. And having worked in my specialty of cardiothoracic surgery, we are quite aware of the needs and the sheer hard work that intensive care involves. So we know that we are going to get the additional help at the isolation center to ensure that Barbadians get the best possible care that this country can deliver. And I am confident that with that, you will be satisfied. COVID is a very lethal disease when it's severe. Not everyone will make it, but those who can make it, I am pretty sure will make it. As the minister alluded to, the initiatives are coming in next week, where we will see some reorganizing of the system, and we trust that this would also improve the quality of care at the institution and make sure that everyone get the best possible care.
Thank you very much, Mr. Harris. And we now go to the Prime Minister.
Thank you very much, Lisa. I want to thank, first of all, the Minister of Health and also Mr. Harris for speaking. I think that we've reached a stage, as the Minister indicated, that we're challenged. We're not overwhelmed, but we're challenged. But I always remind persons, including in my cabinet and to the country, that we should never be surprised by what we expect. Over the course of the last few months, we have been indicating, look, we need to be able to ensure that as many of our people can be vaccinated as possible, because the evidence is absolutely clear that where there is a higher degree of persons with vaccination, you can more or less see the reduction in the positivity rates generally. Indeed, when we were in New York last week, and I alluded to this the last time I spoke to you, that one of the reasons why their positivity rate is as low as it is in New York City has to do with the level of vaccinations and the quantum of vaccinations, I should say. We have been proceeding reasonably well. Of course, we set a target of 10,000 a week. We haven't met it the first 2 weeks. But I also have noticed a difference. In the last 3 days of the last week, we saw a significant increase in the numbers per day, to the point where on Friday we were just under 1,100 persons who had vaccinated. The reality is that we need to hit as close to 1,500 people a day. We also are aware that our duty is to ensure that we can keep the vaccination supply going. That is not easy, and I'm being very straight, as I've always told you. Out there is a very, very difficult environment. Indeed, only today the United Nations Secretary General and the others who are visiting with us would have reflected on the whole issue of vaccine equity and vaccine hesitancy as we go forward. Bottom line, the government will put and continue to put things in place at an institutional level and at the level of the systems to help you. That's why Mr. Harris spoke and Minister spoke about the fact that at our isolation facilities, we are ensuring that we can supplement the numbers of persons working there, particularly the medical personnel, from doctors to nurses to other support staff, because we recognize that being challenged means, first and foremost, that those who have been on the front line working are working continuously and incessantly. And we need to make sure that they can get a rest, because if they're to give the best of themselves, they too also need to be able to step back and rest at some point. On Friday, we were able to pull together a meeting with the Minister of Health would have pulled together for me to address the doctors at the hospital and senior consultants at the hospital, the President of the Barbados Association of Medical Practitioners, and indeed the doctors who have been leading the effort so valiantly at Harrison's Point and other isolation centers. I refer specifically to Dr. Corey Ford, who the public knows well, but also Dr. Anne-Marie Hassel and Dr. Carlos Lovell, who have also been pulling the weight along with another team of doctors. Mr. Harris made it clear and referred to the fact that we expect during the course of this week to see other doctors come in. They know that as Minister of Finance that I am prepared to ensure that we work also with the private medical practitioners. Indeed, we already have a team working with the home quarantine team under Dr. Grandison, and we have another team working with the home isolation team under Dr. Brian Charles. But we've gone further, and we've said that where we need to supplement to ensure that if we have to move people from the QEH to Harrison's Point, that we can supplement back at the QEH. And if we have to move people from the polyclinics to Harrison's Point, we are prepared to bring in people to supplement there. I think Mr. Harris indicated earlier to you just now that in his long and distinguished career, that he's never seen anything as serious and as challenging as this. And we understand it, because the last time that our countries have faced this kind of difficulty, quite frankly, would be for those countries who were in a world war or in a war on the front line, and before that, for those who experienced the last global pandemic, which was in fact the Spanish flu in 1918 to 1920. So we know this is real. But I also want to use this opportunity to remind Barbadians that while the government is doing as much as it can, it comes down ultimately to you and to the extent to which you're prepared to trust your medical practitioner, your doctor. The extent to which you understand that this really continues to be a pandemic, as we've said over and over, of the unvaccinated predominantly. It doesn't mean that a vaccinated person might not have a breakthrough and end up with COVID, but predominantly, and we've seen all but one death attributed now to, in recent times, to those who are unvaccinated, certainly in this last surge. The bottom line is that we all know the facts, that once a person comes into the house with Delta, chances are most people in that household will get it, particularly if they're unvaccinated. If they're vaccinated, they have a chance at fighting it off. And for the most part, one of the messages that we want to underscore, and I keep telling you I'm a Jimmy Cliff girl, I can keep repeating it and repeating it and repeating it. And why? We need to make sure, if you are not feeling well, pick up the phone, call somebody or go to somebody who's a doctor who you trust, and let us get help for you. I have heard Dr. Ford, I've heard Mr. Harris, I've heard Dr. Grandison, I've heard every single doctor, including the one who Paho has as my personal advisor, Dr. Bullock Ducasse, all say, if persons can come forward early enough, we can help them more often than not. But it is when you present late, it's when you present at the point where you're gasping for breath, or where you're already having symptoms and you haven't done anything about it. That is when the problems come. And we regret that we've seen the deaths that we've seen this week, but we also know that it could be far, far worse if we were not at this point in time with the level of vaccinations that we have. And where is that? The country has the dashboard, and I said previously that you can see that we are hovering at about, 38-39% of the overall population. But in truth and in fact, when you look at the people who can take the vaccine, who can be vaccinated, and then you look at who cannot, you realize that from toddlers to 12 years old, you can't take it. And if you were to take them out of the equation, we are already at about 57-58% of the persons who are eligible to take the vaccine taking it. What does that mean? That more than 5 in 10, almost 6 in every 10 Barbadians who can take it are taking it. We don't expect to get 10 out of 10, and we said so from the very beginning. But we do need to push a little harder, and we do need to see if we can get beyond that line of at least 70 to 75% of those eligible, which then will allow us then to look at the rest of the population separately. Why? Because without that, we're going to continue to be challenged to ensure that more Barbadians can come back to work. We'll continue to be challenged in terms of people's movement. We'll continue to be challenged in terms of the economic performance that we need in order to be able to protect those who are most vulnerable. We have rolled out one of the most generous social protection programs of any country, any part of the world, as a developing country. We don't have the luxury of the G7 countries, or the United States of America, or France, or Germany, or China, or Japan. We don't have the luxury of those countries with respect to some of the things that they can do, particularly with quantitative easing and being able to expand their money supply. We have to still live within our means. But even with that, we've made choices. And we've made choices, one, to build facilities that would not put the QEH alone under pressure. Can you imagine if there was no Harrison's Point now as we speak, Minister Bostic? You understand? But at the same time, we're being challenged because we have a variant called Delta, which has literally the level of contagion that chickenpox has. And that's why we need you now to join us shoulder to shoulder in this battle to make sure that, one, wherever possible, please, talk to your doctor, And once you can take the vaccine, go and take it, because that will help us get to that point. Secondly, if you're not feeling well, please call. And I say so from the bottom of my heart, because the doctors keep telling me that will go a long way in reducing the few deaths that we've had compared to other countries, but we can reduce it even further between the vaccinations and the early intervention of the medical professionals in helping you. With respect to the home isolation and home quarantine program, that clearly is, the home isolation program is clearly for low-risk persons. And that's why the government has taken the decision to equip you with a thermometer and a pulse oximeter, so that, as Mr. Harris and Dr. Grandison previously said, we're in a position to take an independent measurement to determine how and what is the next step with you. Because of the backlog, what we were able to start yesterday, and I think we did 598 people out of 603 people out of how many? 600 and right. So we've done 591 people out of 680 as of 4:26 this afternoon. And I expect that when we get the final update for the night, we will have come close to doing the telemedicine triaging of almost all of the persons who were in that zone. We have already arranged for 22 persons to be transported, and I believe that they will, right, 22 have already been transported, and there's another 12 that will be transported this evening before the end of the night. That's 34 out of 598 people who needed then to be put into a more close monitoring isolation facility. That's the kind of thing that can work, but it requires partnership. And that's why we're here tonight talking with you and updating you, because we can win this battle together, but we have to do it together. As I said, the government can only do so much. We've provided the facilities. We're looking for the doctors. Barbados has over 1,300 doctors registered. And while all may not be practicing, we've made it very clear that we need now most of the doctors to come forward and to assist, to ensure that those who have been on the front line for 20 months can help manage without being completely overwhelmed. I'm confident that the response that we've gotten thus far has been very good. And in fact, I leave this press briefing to go and meet with the doctors and the Barbados Association of Medical Practitioners to continue to ensure that we have a stock of persons, not for the immediate use now, but to ensure that if persons need rest, or persons have to step off, or persons get sick, that we have a continuous flow of persons. The Minister reminded you of the team that I indicated last Saturday would come from Northwell. They're already on the ground, and I want to thank them for that. But that is without prejudice to our being able to use as many of our local medical practitioners, because in a very real sense, all have accepted now that this is a national battle, and this is not a battle for the government alone or for Harrison's Point alone. This is a national battle that we can win if we all do the right thing. As I said, given the fact that we are 57–58% of the persons who are capable of being vaccinated, I really do hope that people will redouble their efforts. I'm also speaking to the vaccine team about being able to do better coordination and decentralization as we move around. But at the end of the day, some of you may ask, well, why aren't you mandating? My friends, Barbados has, and it has been home to me even more as we prepare and engage with our friends from overseas. We have one major national asset, and that's called social capital. Whatever report you read about our country, whatever people have to say about Barbados, they talk about the high degree of social capital, the high amount of trust in this society. And while we've gone through difficult times, and while we feel sometimes that some of our younger persons aren't listening, the truth is that a lot more are listening than we think. And that is evident now, even as we go around and seeing them come forward to be vaccinated, and also to be part and parcel of building a future that they want for themselves. If we try to divide this country rather than taking the long road and trying to persuade people and talk people through things, then we will find that we may well end up destroying the social capital that has been very much the foundation for our modern success. At this point in time, therefore, we are working doubly and trebly harder to have those conversations sectorally and geographically. That's why I leave here after a full day with the UN Secretary General and the Secretary General of UNCTAD and CARICOM and the Commonwealth and the President of Guyana. After a full day with them and a full week ahead of us, we go still because drunk or sober, mind your business, and that is at home. And our business at home is to ensure that we keep you safe as well, while at the same time trying to find the economic opportunities that are so critical to keep this economy afloat, trying to ensure that the debt that has been incurred through COVID does not kill us or any other small island developing state, because at the end of the day, we still need to pursue the normal development challenges. And as we discussed again today, also having to borrow for the climate crisis. I left Codrington College just now. That was our last trip. And at Codrington College were still persons who lost their houses in Elsa, and I want to thank them because they, among other public-spirited Barbadians, have been helping us house people while we rebuild these houses. So we face serious issues related to the pandemic and to the climate, but at the same time, we have to live, because we now know without a doubt that this is a marathon. And if this is a marathon, then we can't be shutting down, because what we do is to create more problems in the long run than we do. And my friends, you know I can talk to you straight. Sometimes it's good, sometimes it's bad. But what you can always be assured is that there can be straight talk. And with that straight talk comes then the recognition that the ball is also in a lot of persons' courts now. How do we adhere to the protocols? How do we talk to our doctors? If we were having a belly ache or a headache, we would go to the doctor and ask the doctor for help. And they'd give us some kind of medication, and more often than not, we'd think and take it without questioning. I am saying now, not that you shouldn't question, because you should, but what I am saying to you is that the waiting game is really now not on your side. Too many people have said, I waiting, I waiting, I waiting. But what are we waiting on? The truth is that we've seen that persons who have professed to be waiting are now finding themselves, in some instances, fighting for their lives. And we know, we've seen it in Iceland. We've seen where Iceland, as I've said over and over, because of the high level of vaccination, that they can, in fact, pursue most of the economic activity in that country without pause. Similarly, in Denmark. And if you go around the country, investigate in the countries of the world, investigate for yourselves. So my friends, I believe that as we go into this week, that I ask Barbadians to reflect where we are. Let us also remember that this is not something that is only affecting older people. On average, every day, between 1/4 and 1/5 of the people who are catching COVID, who are COVID positive, are now under the age of 18 years old. This is nothing to play with. If we love our parents, our grandparents, if we love our children, if we are able-bodied and capable, now is the time to stand in the breach and do the right thing. And I'm telling you, I know it, I can feel it, I see it. If we do the right thing, then as I keep saying, we will at least get to a point where some level of normalcy can come back, and where many of those who lost their jobs in the last 20 months can begin to contemplate working and to get the reality of working again, because it means that we have mounted a robust battle against the virus. And the virus is not going to catch and live easily in vaccinated people. The virus is not going to live on its own. The virus needs a host to attach to in order to go forward and go forward and go forward. And that is why I say to you, you ask me, some people ask me, why are you coming and talking to the country so much? I go, I don't have a choice. I don't have a choice. Because I need to talk with the country and to talk people through this, because we assume that everybody knows, but we don't. And it is only in the sharing of knowledge and the sharing and communicating that we are in a position to improve our circumstances. And as I said, when we look around, and others have commented on it, yes, we are far better than most, but being far better than most is not sufficient for me. I want it to close the gap, like how that door just closed. You understand? Close the gap. We want to close the vaccine gap. And we also want to make sure that as we do that, that we can close the unemployment gap. As a nation, as Barbadians working together, I have every confidence that we can do it. And that is why our country tomorrow morning becomes the smallest country ever in the world to host the United Nations Conference for Trade and Development. UNCTAD was that body formed to be able to give developing countries like ourselves a voice. And you may have asked, well, what was this esoteric thing that they get? This is not esoteric. This is about us being able to get policy space so that we can protect our farmers, and that our farmers can help us with food security, so that instead of the market being flooded with food imports, that we can start to protect our farmers. This is about us being able to get the voice and the message across that if we have to keep borrowing money because of the climate crisis, then it makes it difficult for us to do the other things that we want to do as a country, like being able to educate our children, or being able to expand our healthcare services, or doing the things that can produce and promote investment in this country. We believe, therefore, that it is critical that we fight for adaptation funds and resilient funds. And what is that simply? The world right now is on the verge of a serious problem that is incapable of being reversed. That is the increase in temperatures. The Caribbean people and other small island states have said, look, we've already seen an increase since pre-industrial times of 1.2 degrees. We know that if we ever get to 1.5 degrees, it's going to be difficult for us to survive. Well, the sad news is that in spite of us saying so for a long time, the world is likely to go beyond 1.5. And when we go to Glasgow next month, we're likely to see a world that might end up at 2 or 2.1 degrees. If that is going to be the case, it means more storms, more hurricanes, more droughts, more sargassum, more wildfires in other parts of the world. And therefore, it means that we're going to have to take action, just as we've had to do in the last 10, 15 years, where we've had to build protection. You see the boardwalks that we build, a lot of that is to protect against coastal erosion. You see the gabions that we use, that is to protect against the slippage. All of these things cost significant sums of money. I haven't even started to talk about water yet. But if we have to do these things and borrow for them when somebody else outside caused the problem, then it means that it's difficult for us to meet the needs of ordinary development and ordinary Barbadians for the purposes of development. That's why we're hosting this conference here. It's one of the ways where we give our voice more reach, and we start to say, look, you can't only lend me cheap money on the basis of how much earnings I have as a country, because you're penalizing me for being successful over the last 55 years. You need to start lending me money not on the basis of GDP per capita. You need to start lending me money on the basis of my vulnerability. Because if I'm vulnerable to these things, if I'm vulnerable to a groundwater crisis, as many in the country know because of the lack of water, if I'm vulnerable to storms, as we saw with the freak storm, which nobody believes when we tell them what happened in Barbados in that 90 minutes, or even the hurricane. If we're vulnerable to these things, we've got to go and spend money. And already in this financial year, the ashfall from St. Vincent cost not the government but the entire economy about $87 million, of which the government would have spent at least a third of that to be able to deal with what it has to do. Similarly, Hurricane Elsa and the freak storm is likely to cost the government now at least 1.5% of GDP, and there's probably other damage, as I said, in the private sector that will be just under half of 1% of GDP. So all of that is a lot of fancy language to be able to say that the ashfall cost the country about $87 million in losses, and this hurricane and storm will probably cost us over $100 million, $110, $120 million in housing replacement if we are going to deal. And the reality is that the majority of people who lost their houses are below the poverty line. 90% of them are below the poverty line. My friends, we have many challenges, but this country has always distinguished itself by being able to come together and fight the battles that we need to fight to move to the next level. I trust and pray that on this occasion of the pandemic, the majority of you hearing my voice will remember that this is a battle that is not now governments alone, but it is the entire countries. And just as the medical profession has joined us hand in hand as we go forward with these increased numbers, I also ask every Barbadian who is not yet vaccinated to please go and speak to your doctor, ask for the advice, and let us move and carry those numbers up to a level. We don't expect all, but we need more if we're going to close the gap and to begin to turn the corner, which we can so possibly do. But it requires your help and our help as we go forward. I want to thank the doctors and the nurses and the orderlies again on the front line. The truth is that the home isolation and the home quarantine program, in my view, will over the next week or two, I ask the public to be patient. We have to roll out something new. Anytime you're doing something new, it's no different from you doing something new at home. It's no different from you learning something new at home. It's going to take a little time before it becomes habit. And therefore, I'm asking you for your patience. Jeffrey had to remind the country a few nights ago that when you come to Harrison's Point, it's a wonderful facility. And in terms of medical capacity, it is top-notch, equal to anything in the world. But it is not a five-star hotel. And therefore, there will sometimes be issues, especially if people present with additional persons who the people were not expecting. So if you, and we understand why they do come, because if you have a mother with 3 or 4 children and the mother and one child is positive and the other 2 are not, who's she going to leave the children with? So we've had to literally adjust and work with them, and we will continue to do so, because this is not about anybody standing on ceremony now. This is about getting a people and a country to safety. And I'm sure that no other leader of this country would ever want to be in this position. I certainly don't want to be in it, but the reality is that we are. And if we are here, then we must do what we do best. Come together and act as one. This country's level of social capital and capacity to understand has been well documented. And as I said, I'm not going to undermine the country's social capital, but at the same time, I am going to urge, beg, and literally walk around and talk with everybody who I have to talk to remind you that your best protection is, one, monitoring and facing and adhering to the protocols, which is literally washing your hands, wearing your mask, keeping your distance. But equally, the large percentage of protection you get from a vaccination is perhaps one of the most significant game changers. And if you ask me what is different between now and January, and what is different between now and April, in April last year, there was not even a talk about a vaccine in a hurry or nearby. In January, February, and March, we didn't have vaccinations available for the majority of our people. Now, even though there's a surge, we have the benefit of that. And it is that that can help us stave off the level of deaths, even as we fight through it. But it is also that that will help stave off the level of serious hospitalization. And it is that that will allow us to ensure that we do not cause more unemployment by locking down and more people to suffer by locking down. So my friends, we in this together. There's no other way to put it. And it is up to all of us to do the right thing as Barbadians. And I have every confidence that we will do it. And if we have to come week by week and talk with you, we're going to do so, because that is the preferred route to mandating and forcing, because we do not want to lose the essence of who we are. Because when all is said and done, this country is 166 square miles, and all that we have is one another. I ask you, please, help us help you. You're at the center of it now. Half of it is personal responsibility. Half of it is what we provide as a government. We believe we're at that point where that partnership can take us over the hurdle in the next few weeks. Thank you very much.
And thank you very much, Prime Minister, the Honorable Mia Amor Mottley. I would also like to thank the Minister of Health and Wellness, Lieutenant Colonel the Honorable Jeffrey Bostic. We also heard from the Senior Consultant Cardiothoracic Surgeon, Mr. Anthony Harris, and we were also supported by the Consultant Manager of the Home Quarantine Program, Dr. Adana Granison. Do have a good evening. You prefer me to call you Mr. Ellis or David?
Call me David.
David, are you sure? Good afternoon, I'm Lisa Lord and I'm coming to you live from the Harrison Point Isolation Facility here in St. Lucie. I'm joined by the National COVID-19 Advisor, Mr. David Ellis, my co-host for this broadcast. David, we had 168 cases.